Okay, so I'm going to tell you about tearing, and then I'm going to tell you how you can avoid or minimize the degree of tearing. There are vaginal tears, tears on the labia, tears near the urethra or the clitoris. Those are called periclitoral or periurethral tears. And then you have perineal tears. Those are the big ones, right? There are 4 degrees of perineal tearing. First degree affects the skin and tissue only. Second degree affects the muscles of the pelvic floor. Third degree affects the anal sphincter, the external anal sphincter, or the capsule that surrounds the anal sphincter. And then there's a 4th degree, which goes all the way through the external and internal anal sphincter. Now, I consider first and second degree to be normal for childbirth. If you have a tear, because not everybody does, I expect it to be a first or a second degree, unless something happens that makes it more likely for you to tear. For example, like the use of instruments like forceps. Here are my tips for how to minimize or maybe even avoid tearing. Number 1, perineal massage. There's not a lot of evidence to say that this actually works, but there's not a lot of evidence on it in general. It makes sense why it would work. A lot of people swear by it. As long as you're not doing it too rough and you're doing it the right way, it's not going to hurt. So it's something you can try. It's where before you go into labor, you massage and stretch those tissues and get it ready for the big stretch. Number 2 is adequate nutrition. Of course, our tissues are made up of the things that we put in our bodies. If you're eating a lot of processed foods as you get closer and closer to your due date, some of those tissues can be a little bit more susceptible to damage. Number 3, heat. So heat is going to bring blood to the surface of the tissues, to the capillaries. So if you put heat on the perineum by way of either maybe a water birth or warm compresses while you're pushing, it makes those tissues more elastic and less likely to tear. Now, my 4th and final tip, and this is the most important one of all that other stuff, probably isn't even that important if this one doesn't happen. You want your baby's head to be born slowly. And this is why it's so important and why I stress it on my page to find a provider that you truly trust and that has your best interests at heart, because your perineum is in their hands. It is their job to watch your baby's head emerge and to tell you to stop pushing. This part of the pushing phase can be really stressful for babies because their whole body's getting squeezed. And so decelerations in the heart rate can be really common. But hopefully your provider is cool, calm, and experienced enough to recognize the difference between normal physiologic stress that babies are going to experience at this moment and a problematic level of stress that would mean that the baby needs to come out now. And that's all I got for you. If you have any questions, let me know in the comments.